And we're back. And we're back. Now I wonder why it keeps taking. Can you see me, Melanie?
I can't see you.
And we're back. Now I wonder why it keeps taking. Can you see me, Melanie?
I can't see you.
And we're back. Now I wonder why it keeps taking. Can you see me, Melanie?
I can't see you. Okay.
Okay, can you see me now?
Yes.
Can you hear me?
Yes.
Okay, can you see me now?
Yes.
Okay. How do we sound to you guys out there? How do we sound to you guys out there? Okay, I see what the problem is with the echo. What a mess, right? Okay, I see what the problem is with the echo. I have to turn my YouTube sound. What a mess, right? Okay, I see what the problem is with the echo. I have to turn my YouTube sound. What a mess, right? Okay, I see what the problem is with the echo. I have to turn my YouTube. Someone said it sounds good, but I can't turn my audio off on YouTube here. Okay, I see what the problem is with the echo. I have to turn my YouTube. Can you hear me, Melanie?
Yes.
No. You can hear me?
Yes.
Can you hear me now?
Yes. Yes.
Okay. You can hear me?
Yes. Yes.
Can you hear me now?
Yes. Yes.
Okay. You can hear me?
Yes. Yes.
Now it's funny because typically there's a thing on YouTube where I can mute the volume on YouTube.
Yes. Yes.
Now it's funny because typically there's a thing on YouTube where I can mute the volume on YouTube.
Yes. Yes.
Now it's funny because typically there's a thing on. I think I see what the problem is. I think it's my microphone, which stinks. Okay, you can hear me? No repeat, right? Okay, I think we're good.
All right.
All right. I think we're good with the exception that I can't hook my microphone up. I guess that's the issue because it is competing with the audio on YouTube. So.
Okay.
Okay. Everybody, can you guys hear us loud and clear now? Hopefully I got my business in order. No repeating. Someone said no repeating now. Okay. Great. Thank you guys so much for joining us. Oh, okay. All good. You sound loud and clear. Okay, great. Thank you. I guess I can't use my microphone on Zoom with my iPad. How weird. Okay. Terrible. Okay. So thank you guys so much for joining us. So I have with me, I'm super excited tonight because I have with me Dr. Melanie Watkins, who is a psychiatrist. So I thought it would be fun to bring her on and have her answer some amazing questions, just questions that I get sometimes, things that women ask me, even some questions that I myself have. So we're going to talk about, we have a lot to talk about tonight, right? We have some good stuff to talk about. So first, Dr. Mel, I'll let you tell everybody a little bit about yourself.
Well, I practice in Northern California, actually Walnut Creek, California, which is pretty close to Oakland, Berkeley area, about 40 minutes from San Francisco. And I have a small private practice, but I also work at county hospitals. I've worked in jails before, psych emergency. I've worked in addiction, all different aspects of psychiatry. I work with kids, I work with adults, so absolutely love what I do. And as a psychiatrist, sometimes I prescribe medication if indicated. Take care of people who have depression, anxiety, ADHD, bipolar disorder, schizophrenia, substance use. And
wow.
Yeah, it's never a dull moment.
It doesn't, yeah, it sounds like it.
Yeah, so I've been doing this since 2005.
Oh, wow. Okay. So
Yeah.
a long time.
Long time.
Okay. Well, thank you again. Thank you for being here. So hello to everyone in the chat room. Patricia, Nika, Kelly, Cheryl. Hey, Cheryl. Life Coaching 365. Monique. Hey, girl. So we're going to start out with some discussion, and then we're going to have ask Dr. Mel like towards the end. So if you guys have any questions, of course, you can put them up throughout, but make sure you ask all the questions that you feel like you need to ask this evening. So we're going to start out with, what is the purpose of therapy? Because now it's like a trending topic, right? You hear people are like, my dog died, my cat cried, my boyfriend lied, and everybody's like, you need therapy, girl.
Right. Well, I'm glad, first of all, I'm glad that more people are talking about therapy, and that people aren't keeping it secret like they used to do in the past. You know, people would be kind of shy about saying, I'm seeing someone for my mental health. So I'm glad that we're talking about it more, you know, in public and decreasing the stigma about it. So therapy is an opportunity to talk about life's challenges. We all have challenges in life, and get to talk with someone who's a professional who can be objective. A lot different than talking with your girlfriend or talking with your auntie, which is great. They can't be completely objective. So if I talk with my Aunt B about something, I'm going to get the older Black Christian woman filter, right? Everything's going to be through the, baby, just pray about it.
Right.
You know, if I ask advice from my big sister, she's going to talk to me like I'm the little sister, because that's the filter of how she sees me. Doesn't matter that, you know, what I do for a living. My sister's going to give me advice based on her experience and her background. But when you see a professional, they're able to take an objective view, and they have skills and education and training to help you through problems. And so it's really a great opportunity to work through the stuff that we all have experienced. In many ways, a lot of us have experienced some trauma, with COVID, right? Many of us know people who have passed away, people who lost their jobs, people who went through breakups, and the disappointments of missing out on, important life events like graduations and vacations and funerals. The way that I look at it, we should look at therapy and mental health the same way we look at physical health. So there's no shame in going to your doctor for your annual checkup. So why can't you have an emotional, checkup or check-in, and have someone that you can talk with. And then, if you need, more evaluation or testing, you could see a specialist in that area. If you need medication, you can see a psychiatrist if necessary, or a primary care doc. But I think if we just normalized it and people had, a therapist to go to, you may not need to see that person every week for the rest of your life. It might be, I'm going through a really hard time. I need to touch base with someone who knows me, knows about my background, and can help me through it. And then in the future, if I need help again, I have a trusted person that I can go back to help me.
Right. Okay.
Now, therapy, I wanted to point out too, therapy is different from coaching. There's a lot of great life coaches out there. Yeah. So coaches really focus more on the challenges that people might have. I'm thinking about quitting my job. What kind of career might be the career I want to have? Or, I want to start my own business. I want to achieve, running a marathon, a big, goal that you might have. And coaches can be great in terms of keeping you accountable and giving you specific goals to, to tackle. But therapy is different in that we're going to talk about your childhood. We're going to talk about your past, because we strongly feel that that influences how you look at the world, how you exist in the world. When you were a child, you looked to your caregiver, your mom, your dad, your grandma, your grandpa, aunties, to learn about what was safe in the world. How to get your needs met, how to be nurtured, how to take care of yourself, how to be cared for. And if some of those relationships weren't the healthiest, you kind of have a skewed way of getting your needs met at times, or maybe you have a perspective that could be, looked at a bit so that you can have more fulfilling relationships. So we're always going to ask about your childhood, your friendships, your relationships, because that's part of what makes you you.
Oh yeah, absolutely. Definitely what makes you you. And we'll come back to that childhood thing.
Mm-hmm.
And so I had a question. Someone asked me what's the best way to go about finding a therapist first and foremost, and then finding a therapist that fits you, that is right for you.
Yes. So first of all, let me break down the different types of therapists that are available, because a lot of people don't know what's the difference between a psychiatrist or a psychologist or a psychotherapist. So as a psychiatrist, I went to medical school. I have an MD, and so I'm able to prescribe medications when necessary. I do some therapy, and I also do a lot of what we call medication management. Psychologists have their doctorate, so they may have their PhD or their PsyD, and they do regular therapy. They also can do testing. Sometimes we need to do specialized testing in certain situations, and they're trained in that. But the majority of the therapists out there are master's level therapists, and they're quite good. So LCSWs, people who are licensed clinical social workers, marriage and family therapists. And so these master level therapists can be very helpful, and they can do individual therapy, couples therapy, family therapy. And usually what I tell folks, two sites that I really, really like for people to get started in trying to find a therapist are goodtherapy.org and also Psychology Today. And what's nice about these sites is that you can put in your zip code, and then you see a little bio for the different therapists that are in your area. And you get to see which insurances they take, what they specialize in, and they write a little bit about themselves and the services they can provide. And oftentimes they'll offer, a free 15-minute consultation to see if it might be a good fit. Now, I tell people that sometimes that first session with the therapist, it's going to feel a little uncomfortable, but you should kind of listen to your gut. And after a couple of times, if you think that you can't really be you and can't really share what you want to share, the person's not really getting where you're coming from, you can switch to a different therapist. I don't want people to throw the baby out with the bathwater and say, oh, therapy, not for me. People wouldn't do that if it was a mechanic or a hairdresser. They go to the first one and say, oh, that guy just ruined my car. I'm never going to drive a car again. Or that person just cut my hair so crazy. They don't know what they're doing. I think I'm just going to do my own hair for the rest of my life. But with therapy, sometimes the first person may not be the best fit. Sometimes it's a great fit, but just be open to trying out a couple of people if it turns out that it's not really working for you. And then I also want to say that just because someone's of a different gender or a different ethnic background, still be open to that person as a therapist. We want them to be really sensitive and aware. But it doesn't mean that just because that person's of a different background that they can't do good work with you. Because if we were all holding out for a therapist that looked exactly like us,
right,
a lot of people wouldn't get therapy, right?
Yeah.
So
I think that for women, though, I think sometimes it could make it a little easier, but another thing that I wanted to ask was so someone told me at one point in time that they were seeing a therapist, but they didn't feel like they had a connection to the therapist. And I was like, well, I don't think you're supposed to have a connection, so to speak.
It's not a friendship. It's not a friendship. This person just listens to whatever you have to say and they nod and they agree with everything you say. A good therapist is going to get in there and challenge you, okay? Because it's not meant to feel good 100% of the time. So the therapist is supposed to challenge you gently and say, hey, I've noticed this pattern, or, well, you said this led to this, but have you thought about what else might be going on, or what else might this mean? And so then as the patient or the client, you're thinking, wow, I hadn't thought about it that way. Thanks for pointing that out. Okay.
Yeah.
And so it's not supposed to feel totally comfortable, but it has to be someone that you can talk about some really deep, intimate things, with, right? You should be able to talk with that person about the trauma you've experienced, or if you're having sexual issues, or if you're, fearful that your spouse is going to leave you, or you're going to lose your job, or you're having a crisis in spirituality or an existential crisis. Maybe you were brought up Jehovah's Witness and you decided you wanted to leave that religion, and now you need someone to support you through that. Okay. Yeah. So you want to be able to be real with that person. And you can ask tough questions. You can ask them, hey, do you see people of color? Do you feel comfortable talking about, racism and microaggressions? And, you want to make sure they at least have a general idea or handle on some of these issues, even if they're not from your same exact background. Even as a woman, I've had male supervisors who are really excellent. And sometimes we need someone of a different gender, a different background to help us work through some challenges, Let's say a woman's always had challenges with men in relationships, and, she gives too much, or she's overly flirtatious, or whatever it may be. Sometimes having a male therapist can help that person work through that in a different way than a female therapist might. So I just say, keep an open mind.
Right. Yeah, absolutely. I did have one of those therapists that was just listening, but it worked for me because through all my talking, I started to I would say something. I'll be, oh, wait a minute now.
Come and think, what am I saying here? Wait a minute. Okay, you start making the connections. And that actually is part of the process, truth be told. So while you're talking, let's say the therapist is asking what's going on with you. You're having to think about what information is relevant to share with the therapist. You're having to kind of process it as you're sharing that information. You can get clarity in discussing what's going on, and it's therapeutic to vent. Just even talking about it, not carrying it around. So that can be very, very helpful. We just don't want a therapist who's not enough during session or say anything. It's like,
Yeah, absolutely not. Yeah, that was, I think that was the best part for me, because he asked me one question, and because I was going on, I was like, and so-and-so did this, and so-and-so did that. And he says, so all these people did stuff to you, huh? And I was like, yeah. And I was like, oh, wait a minute.
Yeah, who's the common denominator of this? Like, you're in the same situation. All these people are doing this to you.
Right.
Common denominator. Yeah, exactly. And so they're able to gently, in a loving way, in a caring way, a therapeutic way, point out some things that might be blind spots. And we all have blind spots, right?
Oh, yeah.
Well, one of the things I say about therapy is it's one of the most intimate relationships, but also one of the most distant relationships at the same time. So what I mean by that is you're sharing secrets with a therapist that you may never have told, your mama, your daddy, your friend, your best friend. And yet there's the boundaries, right? You don't,
right.
After session, you're not hanging out, watching Netflix together, going on road trips together. It's contained within that space, but it's a very intimate, intense relationship that you have with this person who really gets to see parts of you that you may not have ever shared with anyone else. And it's a real gift. It's a blessing. I mean, I feel very honored to be able to do this kind of work. It doesn't even feel like work a lot of the time too, to be honest.
Oh, well, that means you found your thing then.
Yeah, really, it feels more like a calling,
Yeah.
And that's the kind of passion that, you want your mental health professional to have, that they really are trying to do everything they can, within reason, to be supportive of you on your journey. And they don't give you advice. They're not telling you what to do. They're helping you to be able to come up with the answers for yourself. And that's what's empowering when you see that light bulb go off and the patient, we call them patients, but patient or clients have like their aha moment. And you're like, yes, you just feel so like, I don't do that. But inside I'm like, yes. they got it,
So there was a question. Life Coaching 365 says, at what point, doctor, do you feel the sessions may not be working for the client?
Well, I like to keep it real, and I will touch base with them at times, and I'll say, I'm curious about what's going on between us. How are you feeling about our relationship right now? Because sometimes the client may not have the courage to speak up. They don't want to hurt, your feelings. And so that can be very therapeutic in and of itself when I give the patient an opportunity to share with me what they feel isn't working. Well, doc, I was really upset you were late to our session, or doc, I noticed you answered the phone while I was trying to talk with you, and that made me feel very ignored and unseen. Well, let's process that. Let's work through that, right? Now, sometimes it gets to a point where they might need what we call a higher level of care than what I can provide, right? So we have treatment programs available, sometimes residential programs for some patients. They used to call them 28-day programs. Sometimes we have programs for people who, it's called partial hospitalization, where people can get intensive therapy, group and individual, 5 days a week. And sometimes intensive outpatient, which is usually 3 days a week, and they can get some extra care and support, because sometimes coming in just once a week or once a month isn't going to be sufficient for some folks.
Right.
And sometimes people need inpatient treatment. They need to go in the hospital if they're acutely suicidal, just so overwhelmed with life stressors, they can't function. People who have psychosis, impaired contact with reality, or their substance use is out of control. They need to be in a contained, structured environment for a little while.
Right. I'm wondering if we should have had a crisis number up on the screen here. Someone said they've been on coke, pills, and alcohol and ready to die.
Oh, well, there's the suicide hotline.
And please call the suicide hotline.
Yes.
I'm thinking it's a troll, though. I don't know.
It could be, yeah. But I think it's just good for people actually to have that number. So I know the last 4 numbers ends in talk, but I don't have it memorized. I'm just looking it up here for you guys. Suicide hotline. Okay, if people are in a crisis, it's just good to know. Or if you might have a loved one that you're concerned about. So it's 1-800-273-8255. 800-273-8255. And it's 24/7 crisis hotline for folks, all over the States. I know you have some international
viewers, yeah.
Viewers.
I go back to Royalty. Royalty says, I recently had a therapist. Why did I pull the race card when I said my SIP was racist? Clarify, I had a therapist that asked me, why did I pull the race card when I stated my supervisor was a racist and never went back.
Oh, wow. Well, even, that's my doggy there. Even the fact that a therapist may have asked that question that way might be a bit concerning, right? I mean, to say race card has a lot of connotations to it, right?
Right.
I probably would have phrased that in a different way. How do you feel that your race impacted your relationship with your supervisor? And let's talk about that a bit and what you can do to take care of yourself and advocate for yourself in that type of situation, right? Mm-hmm. And so you might even gently confront the therapist and just say, I felt really disappointed when you brought up, the term race card. Can you tell me a little bit more what you meant by that and how you feel like that might be helpful for me and what I'm dealing with right now?
Right.
It takes a lot of courage to say something like that, though, too, to a therapist. But
yeah,
you need to advocate for yourself even in your therapy, and that can be a great opportunity for you to learn how to assert yourself, speak up for yourself, and get your needs met. And so by saying, I felt a little uncomfortable, or I felt disappointed, I felt angry, I was very angry when you canceled our appointment, the same day, or I was worried about you when you canceled our appointment the same day. I'd like to talk with you about that.
Yeah. Okay. Yeah, just being open and, like you said, assertive. I'm spending my cash here.
Right, and that's the thing too. You're paying for this, and so
right.
You deserve to have someone that you can be real with. And if that therapist is using terminology or minimizing your feelings, you need to talk about that. If you're talking about microaggressions and this person is saying you're being too sensitive, that may not be a good fit for you. If they can't talk with you about what you're experiencing, what you're feeling, and you can't be real with them about that, and how do I deal with this in the workplace or when I'm going shopping, I'm very concerned about, the racial tension and what's going on right now. Well, then if you can't be real with that therapist, in a mutually respectful way, then it may not be a good fit.
Right.
Or if you have to explain what microaggressions is all the time, that's not, that makes it harder when you feel like you have to explain every little thing. Because when you initially have that consultation, ideally you'd be asking them, do you have experience treating people who have concerns with this, or people who've had problems in this area or that area?
Right. So the next question I had, or the next topic I had was, and this kind of goes back to that childhood trauma that you touched on a little bit earlier, was beginning the healing process.
Mm-hmm.
So that's a question I get often, like, where do I start? How do I begin the healing process? And it's not, of course, I don't guess it works the same for everybody, but for the most part.
Yeah. So I think this is a great question. And first of all, it's having awareness and willingness to do something about it. So we're all walking around with little wounds from our childhood, where we weren't validated. Maybe we were neglected in some way. We were physically abused, emotionally abused. And so very few of us have had an idyllic, childhood. A lot of us went through some stuff. Right. And so the first off is just the awareness, because it's how we grew up that influences how we exist in the world and how we perceive others' experiences of us, right? So maybe I'm sensitive if someone's looking at me while I'm shopping because, when I was growing up, I never felt comfortable in stores because people assume that I might be trying to steal something. And so when people look at me a certain way, I always think that they think that I'm going to steal. Well, they may just be glancing my way and they like my outfit,
right. Right.
And so we have these little wounds going on that people can't see, but it does affect how we exist in the world. So the way that I like to describe this, I was trying to share this with someone because they hit a sensitive thing for me, okay, where we were in a store and he was like, "You got this, right? Like, you're gonna pay for this, okay? You got this, right?" No, I mean, I could have this, but I'm not going to have this for you because, so all of a sudden my stuff's coming up, right? When people go, I should pay for everything because I'm the doctor, or I got lots of money and people just expect I'm going to take. So I felt my, blood pressure, my heart rate going up because I don't like when people assume I'm going to take care of everything. Again, see, even as a doctor, like we all have our stuff, right? But it's awareness of it that kind of triggered me a bit. I said, look, it's almost like, let's say you want to give me a back massage. You see that I'm stressed, I'm walking around like this, and you really want to give me a back massage. But you don't know, and I didn't tell you that I have this very sore spot right here. And so here you go, you're going in, it's going well, it's feeling good, and then ouch.
You hit that
You're
spot.
hurting me. Right, you're hurting me. Well, I need to tell you that this is an area that's very sensitive for me that I just want you to be aware of. I need to assert myself and tell you this is something that is uncomfortable for me. And I want you to respect the fact that I still love massages, but you need to be especially careful in this area. I'm a bit sensitive to this. And so that's where the healing happens when you're able to acknowledge that you have that wound. You're able to be aware of when it starts bringing up your stuff, and you can assert yourself in a respectful way about what your needs are. When you give me a massage, I really appreciate that you want to care for me, but I need you to also know that I have the sore spot here that you need to be aware of, and please mind that when you're trying to take care of me. And so that's what I was trying to tell him, like, look, my sore spot is when I go out to eat with 5 friends and they're all looking at me and everyone's lost their checkbook.
Right.
And they're looking at me, like, hey, wait a minute, you also chose this restaurant with me and we can all pay our way. And sometimes I want to be very generous, but not all the time. Right. So that's my little sore spot. And that's okay. I own it. But it has a lot to do with, my childhood stuff, feeling responsible and taking care of things and family and feeling very competent, but then feeling, resentful at times. Like, why are you putting this all on me to take care of everything? And, that kind of thing. So yeah, I think just having that awareness of where you have those wounds is a huge step in wanting to do something about it versus going on everyone who, gets that sore spot and they don't even know it's a sore spot.
Right. Just basically acknowledging the things that, have gone on that trigger you.
Yes.
So it's okay to be triggered. It's okay to have triggers, but it's how you deal with the triggers, right? Is that?
Yes, exactly. Yeah. Exactly. We don't try to make these things go away. We want to be aware and we want to be less reactive to them, Right. When someone's looking at me, where I perceive they're looking at me a certain way, when I'm in a department store and I'm just trying to shop and mind my own business, I can understand, okay, that's something that's a vulnerability for me. I'm feeling a little, bothered by this, but I'm able to look at the big picture. Like, it's probably not what I think it is. Sometimes it is what I think it is, but oftentimes it's not. But I'm especially sensitive and attuned to that based on my own personal experiences.
Right. Yeah. Okay. So acknowledge it, everyone.
Yes. And be willing to do the work, and a really good therapist can help you through that. And that therapist isn't going to shame you, make you feel bad for having the feelings that you feel. You might even learn a lot about yourself and saying, I wondered why that always bothered me. I wonder why that always bothered me so much. And now I kind of have more of an understanding why. It's because of how I grew up and how I experienced things early on before I was even fully aware of them. And that's why I feel pretty sensitive in this area. So I just need to be aware of it.
Yeah. NDSXXL. NDSXXL. We really would like to have you call that number. So the next thing I wanted to talk about was toxic family members.
Yes, I love
cut
this.
Them off,
This is one of my favorite topics.
Not cut them off.
Yes, yeah. So
this one a lot because I see this a lot on social media. Family can get cut off too, or and back in the day it was like, blood is thicker than water, and now it's like, no.
Well, the thing is, we don't choose our family, but we choose how we want to show up with our family. Okay.
Absolutely. I love that. I love that. Yes. Yeah.
And
say that again.
we don't choose our family, but we get to choose how we show up with our family. Okay.
Great.
And so we all have people in our family that, bother us sometimes. They drink too much. They go off on us too much. They treat us like we're still 10 years old. There's always stuff in families, right? They keep asking me for money. No one else wants to chip in. I feel like it's on me to take care of, grandma. No one else wants to help out. I mean, I could just give you thousands of examples of challenges in families. So first of all, it starts with awareness, because a lot of people just aren't really going to change. It's going to take a lot for people to change. So if I know that my brothers, some are Republicans, some are Democrat, and it's always going to be at the holidays, there's going to be some tension, right?
All right.
So the awareness of knowing that, then I can choose how I want to take care of myself. So maybe when that stuff starts happening, I excuse myself. I go to, the restroom for a little bit. I get my cousin or my niece, say, let's go for a walk. I just remove myself from the situation for a little bit and come back after things have cooled off for a bit. That's just an example. So I don't get in there and say, why do you guys always argue? Every Thanksgiving, we got the same, discussion, and you guys drink and you start arguing about this stuff and it makes it all uncomfortable for everybody. I take care of myself by removing myself from the situation because I don't want to hear all of that. That doesn't feel good for me on my Thanksgiving holiday to have to observe, all the arguments about stuff with no resolution. Okay. So you can take a break and take care of yourself. So that's one thing. Another thing, setting boundaries. So let's say, you have a cousin that calls you, and every time she calls, she wants to talk on the phone for 2 hours about nothing. Well, it's really about something, but let's say she's talking about.
No, it's about nothing. My grandmother used to say 10 minutes or more, you talking about nothing.
Right. So your grandmother knew about setting a boundary, right? So okay, cousin Deborah's calling, and it's going to be 2 hours of your Sunday that you don't want to spend on the phone. Okay. You can decide ahead of time, I feel like I can devote about 20 minutes to cousin Deborah, and then I'm going to wrap it up. Now, cousin Deborah doesn't need to know this, but you've decided in your mind, you're going to have this boundary with her. And so when it gets close to that 20-minute mark, you've already decided, cousin Deborah, it's been so good talking with you. I got to get going. I got to take my dog out for a walk. We'll catch up again another time. And you just have that boundary in place. We teach people how to treat us. That's a classic Dr. Phil line right there. We teach people how to treat us. And so if cousin Deborah in the past knows that she can keep you on the phone 2, 3, 4 hours on your weekend, your precious time off, and you start feeling resentful and frustrated, you don't want to answer the phone and all this stuff, you can decide to have that boundary. You don't have to say, Deborah, my boundary is going to be that I'm going to get off the phone with you at the 20-minute mark. It's just you've decided, I'm going to wrap this up at 20 minutes, and it won't be perfect. The first time you may decide 20 minutes, but it ends up being 30 minutes or 45 minutes, but you might try again the next time. But at least you're aware that it doesn't serve you well to stay on the phone with her for hours and hours on your day off, and you always feel resentful and frustrated, and I could have been doing this and that, and I heard all her stress and drama, and she never asked any questions about me. And no. And Deborah will learn.
Let me ask you this though, okay? Because this is one of my struggles in life, okay? Is there something wrong with saying, "Hey, Deborah, when you call, you talk too long on the phone"? I don't have a dog to walk, but I'm going to be with you for 15 minutes today because I'm tired. I cannot do too much. Is there something wrong with that? Like, because, people say you don't have to say everything you feel. Where do you draw the line between telling people what they need to hear and sugarcoating with these toxic family members?
Yeah. So chances are you're not going to change Deborah's behavior by saying you talk too much. Okay. She's just going to get more upset, more frustrated. So you have to think about what's my intention. And what I like to think about is, what's my intention? Do I want to keep this relationship going? Right? Well, yeah, I love cousin Deborah. She's really fun sometimes, but she just talks too much. I want to keep this relationship going. I want her to feel heard. I want it to be mutually beneficial. I want to stay connected with my family. So if you're going to just bluntly tell her she talks too much, you're not going to get what you want.
Right.
She's going to get hurt, frustrated. She's going to come back at you, but you think you're so perfect and blah, 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 all that crap, right? It's not going to be good. Trust me. Because she's not going to say, you know what? I never realized that I talk that much. I will change my behavior. Deborah ain't going to say that.
She's just going to keep on keeping on.
Annoying you, right? So by you setting these boundaries, she's going to learn indirectly, like, oh, wow, well, my cousin isn't one who wants to stay on the phone very long. She doesn't talk as long on the phone as my other cousins. I'll call one of my other cousins next time and she'll talk with me for 3 hours.
Yeah. Now, what about the toxic family members that are like way past toxic? I mean, like when they call, it's always serious drama. Something's always wrong. It's almost like it almost brings you down to have a conversation with them because everything is always negative. It's there are drugs involved, there's alcohol involved. What about that level of toxic?
Well, and I know that they should be in therapy, but you can't just say you should be in therapy
and treatment and some more stuff, but
so what I would say is having a heart-to-heart to them and say, well, I call it the feedback sandwich. Some of you may have heard about the feedback sandwich. You want to start with something positive. One of the things I really like about you, Aunt Rosie, is that you were there for me when I was a little girl. I love our memories together and all the trips we took, however, it's really hard for me sometimes because when I see you calling, I'm concerned. I don't feel like answering the phone because I'm afraid we're going to be talking about, your son's drug use. Mm-hmm. And I'm concerned about you. I really want you to get the help that you need and deserve. Can I maybe help you with finding someone who's a professional, who's better equipped or more capable than I am of helping you sort through this? So I would say something like that, where, you're validating what they're experiencing. Like, this is really hard for you. You don't want to have a son who was addicted and you're feeling alone and overwhelmed. And you really like to talk with me and get this off your shoulders. However, it's affecting our relationship because sometimes when you call, to be honest with you, I don't want to answer the phone because I feel like I can't do enough for you. I want to support you, but, I don't feel like I'm the best person to be able to help you through this. And, there's some folks that might be able to provide you a little more support and give you what you need and deserve at this time while you're trying to be there for your son. So let me help you with finding some folks. I know a couple of websites and I can put in your zip code and find someone that you can see. That's how I would handle that kind of situation.
Yeah. But so basically,
you want to be loving. I know this stuff sounds kind of like, come on now.
Yeah. I think, I mean, you want to be loving, you want to be available, but yeah.
You're also being real and telling them sometimes I don't want to answer the phone.
Right.
That's where you're speaking your truth. Sometimes when I see your number on my caller ID, I don't want to answer the phone because I feel frustrated because I can't help you the way that you need help and support through this. I wish I could give you more, but I'm just not in a position where I can do that. So let's help you get some more support than what I can give you. I'm here as your niece. I'll always be here for you, but I'm not able to do a lot more than what I'm doing right now.
Yeah. Okay. Now, speaking of family members, I had this is good. Because I had this conversation with someone else as well about this same topic. So let's say, for instance, this is about trauma and how sometimes some people see trauma in a completely different way than you saw it. I'm going to use a sibling of mine, for example. Will say something along the lines of, he'll tell a story and he'll be like, and the police came and they dragged me down the street kicking and screaming and I wasn't doing anything, and they bashed my head into the window, and the rest of us are like, that didn't happen. That did not happen like that. And he's being very genuine.
Yeah.
And this is really the way I've heard it explained as traumalized.
Traumalized.
Traumalized, right?
Yeah.
This is really the way that he saw this certain situation occurring, and it used to upset me, right? I used to get really upset because he was like, oh, you guys got treated like kings and queens, and they treated me like a peasant, and and I'm like,
extremes, what? Right?
Yeah. And so I thought it would be good to talk about that, like how people see trauma different, how it affects different people different. And I guess you can't really get upset with the individual that has created.
So and you probably know what I'm gonna say is that you sometimes you have to roll with it and validate what they experience, because why refute what they said? They feel what they feel. It's their perception of reality. Their perception of reality. It may not be reality. It's their perception of what happened. And in some ways, it's crying out for help. Like, I want you to see what I went through when these officers arrested me. I felt very alone and scared. And so that's what he's really trying to share with you, regardless of whether his head was bashed in or not. He's basically crying out and saying, I went through a traumatic experience and I want you all to see me and be aware of that. And so, validating him, and saying something like, that just sounds horrible. I'm so sad that you went through that. I really am. That would be so therapeutic for him to feel heard and seen, versus saying it didn't happen like that, even though you might be thinking it didn't happen like that. But again, what do you want from this relationship? Do you want him to feel even more unseen and unheard?
Yeah, I get that now. I really do. And
in a moment, I know years ago, you're probably like, what is he talking about?
Yeah, but that I need to take that approach with the situation. Just, oh my God, I'm so sorry, you went through that. Instead of saying, no, that did not happen like that, or no, you didn't get the worst.
Or even saying that sounds horrible. That sounds really, really bad. Because what he is describing does sound horrible and really scary and really bad. And whether he went through those exact things or not, it's not our job to figure that out, because we'll never be able to figure that out, right?
Right. Just roll with it. Just go. And what can I do for you? What can we do to help you? Yeah.
Right. And I think the number one thing that you'd be doing to help him is for him to feel seen and validated and not judged for having his feelings. Because sometimes people do the traumalized thing because they want people to, like, you don't see what I've been through, so I'm going to even like share it in a very big dramatic way.
Yeah, right.
So that I get that validation. So you really would really hear what this meant to me to go through this. It's a cry for help, but in a different way. Because he's not able to articulate, I was really scared. I thought I was going to lose my life and I didn't know any way out. I felt so trapped. I felt so lonely. I felt so sad. He's not able to articulate in that way. So he's going to tell you, they did this to me. They did that to me. And then this happened. And because you can't imagine him saying, I felt so sad and lonely and scared.
No, he would never say that.
He's communicating it in a different way. And so then our job is to say, that sounds horrible. I'm glad you're okay now, but that just, I can't imagine going through that.
Yeah. Okay, that's great advice. I will definitely, that's how I'm going to handle the situation from now on.
Yeah, it takes some practice and some finesse because we didn't grow up like this. You know, we're used to saying like, you're crazy. Like, what are you talking about? Like, that did not happen like that. Like, challenging the person, but then that's not validating their experience of it. And so now we need to work on looking at trauma for what it is when people really are crying for help, but they just can't articulate it the way that, you know, we would expect them to.
Right. Okay. Now, someone asked in the questions, for everybody who just joined or joined in a little bit late, we're going to have Ask Dr. Mel at like towards the end here. So all your questions we're going to answer. Someone asked, I think it was something along the lines of what percentage of male clients do you see?
Oh,
like 98? No.
Oh, no. Actually, I would say, so in my private practice, I'd say a third in my private practice. And then at the hospital in the county setting, you know, probably 50-50. Yeah. But I'm curious why they would assume that I'd see more men.
Huh?
Was there the assumption that I would see more men, like men have more problems than women, or what?
Well, I don't know what the individual that was asking the question, but I always wonder if men are as willing to go seek therapy as women are.
Yeah, very, very good question. So I've found for some of my male patients that things have really had to get pretty bad for them to come in and see me, right? They're calling someone who's a different gender. I've even had male patients, white male patients, tell me that they chose me because not only am I well educated, but they'll say something like, I can tell you've been through something. Like if you're a Black woman, like kind of reading between the lines, they'll say if you're a Black woman who's graduated from Stanford and successful in private practice, you've probably been through a lot. And so I want someone who's been through some real challenges because I feel like I'm going through a real challenge right now. They don't want someone who's had a perceived easy life, whatever that might mean. But which I find that interesting too. Or sometimes they've even told me, you know, you weren't my first choice. Like they were looking for, you know, white male, and then down on like, you know, number 6, 7, you know, they call my office and I had some availability and they come in and then they're actually pleasantly surprised. And they're like, yeah, you know, I wouldn't have thought that I would have had such a great connection with you because we're so different. But no, I found that like, with men, usually it's more of an intense situation by the time they come to see me because women, you know, we're more comfortable in talking about our feelings and, you know, I should see someone and I got this going on and that going on. But with men, it's gotten pretty, you know, pretty difficult by the time they come in. I wish they'd come in earlier, but I'm always glad to see them and glad that they're here.
Yeah, that's interesting. I didn't think there would be a lot of men just like lined up, you know.
Yeah, well, some of it is with COVID. We've had a bit of a mental health epidemic along with this pandemic because men have
absolutely, I'm sure.
You know, relationship loss, breakups, just all the being at home and having the young kids at home and with the wife and or it's been very interesting how the demographics have changed a bit with COVID.
Yeah. Oh yeah, COVID has changed everything, right? Let's talk about the most abused word of 2020 and 2021. Are we ready for this? Please explain to the audience, what is a narcissist? Okay? What is this? When I say the most abused, I said this earlier, you could tell someone like, girl, my husband put his left shoe on before he put his right shoe on, and they'll be like, narcissist, get away from it. It's like everybody is, this is how we describe 90% of the population. Call me narcissistic. I've had people in my comment section call me narcissistic. Yeah, like it's like I'm doing a fragrance video. Where do you get narcissistic from that?
They jump to that, right? Oh gosh, yeah, it is. Yeah, a term that's kind of just tossed around. I think too, because of our former president, a lot of people started using that word a bit more because they were.
Is that where it came from?
Well, I mean, I think that people started talking about it more and more because they were seeing someone who exhibited a lot of those traits in office.
Right. Yeah.
So the way that we look at it in the mental health field is we refer to our Bible of mental health called the DSM, and it's this big book that we use. And all the common diagnoses that we use in mental health. And so we look at narcissism as a personality disorder. And so this is a way of looking at the world and at oneself that's pervasive throughout, the life, usually after age 18, make the diagnosis. But these people have, grandiose sense of self. They tend to lack empathy. They're the kind of people who will say, oh, I feel great. I just ran a marathon and brag about it in front of a patient who has cancer. Okay. These are people who really just can't put themselves in other people's shoes, and they expect the best. They want to golf at the best golf courses. They want to eat at the best restaurants, and they want to only associate themselves with other, great, wonderful things. And so what happens is in these relationships with people who truly are narcissistic is they will start off by doing a lot of the love bombing, they call it, where they will come on very strong in the relationship. Oh, you're the best person for me. Maybe lots of flowers, lots of romance. And they really have put the person on a pedestal. And
listen to these ladies.
Yeah, right. So you're like, oh my gosh, this guy is so great. But then they start just kind of doing these digs at you, right? And they'll start doing what we call devaluing you. So they might say something like, your friends aren't very smart. Or, that school you went to, that's not a very good school. Really, you should have went to Harvard instead. Or they might be dismissive of your family. Like, I don't think we really should have you spending much time with your mom anymore. I think she's not really good for you. So they'll try to like isolate you and kind of cut you off from other people who will point out how, weird this person is, right? Yeah. And so then it just really plays this trick with your head, because you're thinking, what happened to that wonderful person that I met, months and months ago? And now this person is treating me like crap. They used to love me so much and be there for me. And now they're being dismissive of me. They're not, caring about my feelings. I try to assert myself, and then they put me down for having any thoughts and feelings or opinions. And so it's very hard. It's very traumatic for people to be in these relationships, because they're seeing the facade, what they thought the person was, but it's not really who that person was. It's all about the show. And then too, what they'll do sometimes is they'll talk about the crazy ex, and then you end up feeling crazy because it's crazy making, Like, oh, I don't talk to that girl anymore. She was crazy, but the girl's trying to warn you, like, girl, who you're with, you don't want to be with him. He's a narcissist. And then he talked about his crazy ex, and then you're feeling crazy for, believing him and staying with him because he's doing all this inconsistent stuff. So narcissistic personality disorder is about 6% of the population. And 50 to 75% or so are male. I think where people start kind of just throwing the term around is, we all kind of get in our own little world and can sometimes feel like, we're great at this and we're really confident in that, but it doesn't necessarily mean that they're narcissistic, right? Sometimes people just aren't emotionally available, whether their own trauma, they can't go deep, they can't go there, they kind of, just brush things off, blow things off. And we think that they're narcissists, but sometimes it's just they're not in tune with their feelings. Sometimes they're on the spectrum. They could have an autistic spectrum disorder. We used to call it Asperger's, where, like you're not connecting with them, and they feel like you see them as being in their own little world and very rigid about their routines and behavior, but there could be something else diagnostically going on. And so there's a lot of reasons why people might appear to be narcissists, but they may not really actually be narcissists by the criteria.
Right. Okay. So that's not the the diagnosis for everyone, right?
No. And so if I would tell your viewers, if they are in a relationship and they suspect that the person might have some narcissistic traits, a couple of things they can do to check in with themselves. How do I feel about myself in this relationship? How do I feel about myself in relationship to this person? Do I feel like I am being the best version of myself and this person is truly, genuinely helping to support me in my, goals and dreams, and I can support them as well? Or do I feel anxious about myself? I feel bad about myself when I'm with this person. Things start off good and it's like I'm walking on eggshells and I feel like, he can say something and or she can say something and I just crumble. I don't feel like I have a solid sense of self and self-esteem when I'm with this person. I have to walk on eggshells. I have to be very careful what I say because they're going to say something to make me feel bad, or I'm going to say the wrong thing, and then they're going to just punish me the rest of the day or the vacation or whatever because I chose to assert myself. So really be in tune with how am I feeling about myself in relationship with this person.
Yeah,
I was going to diagnosis they might have. It's not your job to diagnose them. Your job is to take care of yourself and figure out for yourself, this doesn't feel good. This doesn't resonate with me. This doesn't feel right with me. And I need to do something about that. Yeah. And if you can't talk with that person about what's coming up, then they're not for you.
Right. Because I'm wondering, like, it seems like a narcissistic individual would only really be able to control someone who is not, who is not asserting themselves, right? Who is not doing what they need to do.
Yeah, because they're not going to tolerate someone who's going to be asserting themselves all the time, who's going to call them out their stuff. Yeah, they're not going to be. It's very interesting who they choose. They choose, women who are caring and attractive. Because again, they want, the arm candy, right? They want someone who is caring and giving and loving and generous, who, doesn't, test the waters too much, doesn't challenge people too much, supportive. They love those traits because someone who has a strong sense of self, who's going to assert themselves and talk about what their needs and wants and values are in a relationship, they can't tolerate that. They're not going to stay around for that.
Right. And now you could be with,
they want supply. They call it narcissistic supply. They want someone who's going to, build up their ego. They don't want someone who's going to be making them have to be aware of what they're doing.
Right. And so you could be with someone who is a narcissist, or you could be with someone who is just plain mean, right?
Because, right. Oh yeah, sometimes
it doesn't necessarily mean that they're
again, whether
display some of those behaviors.
Right. Whether they're mean, it's narcissism, it's they're on the spectrum, they got substance use issues, whatever it is. How am I feeling about myself in this relationship with this person? Just always ask yourself, am I able to assert my needs, my wants, and my feelings in this relationship in a respectful way? And if you can't do that, if they're like devaluing you and demeaning you every time you try to speak up for yourself, no, it's not going to work.
Yes. Okay. Well, I'm glad we could get that out of the way. So everybody in the comment section, stop using the word narcissist so much. Sometimes when I hear people say that, I'm like, do you even know what that means? Do you even know like who this person is? It's just, or did you just get that word off of social media?
Yeah.
All right. Is it Izzy B? Izzy B is on the delete button this evening.
Okay.
I think that's where that's coming from. I'm not S. Crockett, so I'm going to go through some of the comments in the comment section.
Sure.
So S. Crockett says, as a woman, I feel so sad that I believe I have some of these traits. I think many people probably have some of those traits, but those are just things that need to be worked on, right? Like you need to work on it.
Yeah, I would say that people who are aware that they have some of these traits likely don't have the personality disorder because the people who actually have narcissism, they're totally clueless about it. You couldn't even tell them that they don't come in for treatment. They don't see anything's wrong. It's you who has the problem, not them.
Right.
So I think that you're questioning that tells me you're someone who wants to be self-aware and be in check and in tune with yourself and look at those areas in your life where you feel like, okay, maybe I'm spending too much time more time than I'm comfortable with doing this or excluding this person or that person. So I think that's just you checking in with yourself and looking at your values, your wants and needs, and decide how you want to relate to others. People who have to question and wonder if they might be narcissistic usually aren't.
Oh, he said those people have retracted their own comments. Okay. So let's talk a little bit about self-care before I go to some more questions, because we haven't had an opportunity to touch on that yet. Self-care, the most important thing.
Yes. So self-care, yeah. So I tell people, I kind of joke sometimes when I'm seeing patients, and I'll say, look, if I wasn't taking care of myself and I showed up looking all haggard, hadn't brushed my teeth, hair's all messy, clothes are wrinkly, and I show up saying, I'm here to take care of you, you'd be like,
not.
And showing up saying they're going to take care of my mental health, right? So I have to take care of myself in order to be the most effective person I can be. So it's a must, right? It's a must. Yeah. So moms and dads need to be able to take care of themselves, else they're not going to be able to take care of their kids. And it's the overused example, but about the plane, oxygen mask in the plane, you got to put it on yourself first before you put it on, someone else that needs help. Because if, you're trying to put the mask on them and you can't breathe, and then you're both going to be,
right.
So I think it's really important to carve out that time, just like you would a doctor's appointment or anything else you have going on, a work meeting, to take care of yourself. And I would love for all of you to consider keeping a journal, an example of how you've taken care of yourself each day. So one of the things that I did to take care of myself today is I went on a crazy 30-mile bike ride. Oh, yes.
30 miles.
30 miles this morning, 30 miles. Yeah.
A long way.
A long way. But it felt so good. And I was with friends that I really enjoyed, and the weather was just perfect. And we all supported each other. We took our time. And so every day I want you to have an example of how you've chosen to take good care of yourself. And that could be you decided to watch a funny movie or a funny YouTube video. That could be you exercised, you made healthy food choices. You talked with a friend that you hadn't talked with for a while. And so work on building that, repertoire, being an excellent example of someone who takes care of themselves. I love that. I want to be an excellent example of someone who takes care of themselves. And it's not selfish. It's important. Again, like I said, you're not going to be very effective in being there for the people you really care and love if you're not taking care of yourself first.
Right.
If you end up feeling resentful and just overwhelmed, you don't answer the phone, you go off on people because you're not taking care of yourself. That's all data that you're not taking care of yourself. It's like, oh, there's someone else calling me about something, or gosh, this person needs this, and I never have any time for myself. Well, if you have kiddos, I have a 27-year-old, and when I was studying in med school, I was a single mom. I had to carve out the time to get up at 3:30, and study and take care of things I need to take care of before he woke up. And so you have to carve out that time to take care of yourself, because then you're going to end up just feeling resentful and frustrated and overwhelmed and always behind, always running behind. And that's a good place to be.
Absolutely. Journaling for me is part of my self-care. It's just how I choose to sit, and usually I will do it in here, close the door, everything's quiet, and just, write it all down. So
it's a great gift to yourself. It really is, because then your future self has the journals to look back on. And I've been a journaler since I was 16 years old. And Yeah, so I can tell you roughly what I was doing May 29th, 2001, May 29th, 1999. And so you get to look at all that you've been through and like, wow, I went through that, this is what happened. And so you look at how resilient you are and how you've overcome challenges before, and that just makes you stronger. And you have compassion for your 20-something-year-old self or your 30-something-year-old self for what you went through,
Yeah, I feel real sorry for her.
She was learning, she was growing, she's part of who you are today,
Yeah, absolutely. But I like to talk about self-care because I think sometimes as women, we feel bad when we make ourselves a priority, especially when we put ourselves before anything else.
Mm-hmm.
And I talked about one time in a video, I said, if you ask most women, what is the pecking order, the order of importance in your house, they will say, my children, my husband, and then they'll put them little selves at the end of and I'm like, no, that's not right. It's not correct.
Again, like same thing, like, are you going to be a good parent if you're not taking care of yourself? So you're eating junk, you're trying to get the kids together, and you're running late taking them to school because you're not taking care of yourself. I mean, you really can't be effective for other people if you're not taking care of yourself. And so it's important that you carve out that time. Even if you want to reframe it and look at it as, I'm choosing to do this for myself to be the best wife I can be the best mom I can be. I'm choosing to take this time for myself so that I can show up as the best for these people. If you have to reframe it and look at it that way, I'm fine with that.
Yeah. And you have to teach your family, like goes back to what the old Dr. Phil saying, you teach people how to treat you. Yes. You have to teach your family that your self-care time is very important. It's detrimental to their health.
Yes. Yes, right. Trust me, you want me to be taking care of myself, okay? Because it's not going to be a good look.
Absolutely, and you have to make them respect that time, and because sometimes we are made to feel guilty. Excuse me. Like, what? You're gonna go get your nails done. Your kids gotta go here. This gotta happen. To that, and so women are like, okay, well, I'll put myself last, and
that whole martyr thing. Yeah, no, that's not good. A lot of people don't respect people who are martyrs like that. And when I say martyrs, like, oh no, I can't do this. They come first. No, not me. And no, I can't go to your party because my kids have, people don't respect people who are constantly doing that stuff, because it shows that you don't care. You don't have the self-esteem, the self-confidence, the self-worth to be able to prioritize and arrange your life, the way that it needs to be arranged to be effective.
Yeah. What's your biggest piece of advice to women about how to build their self-esteem when they have extremely low self-esteem? What are 3 things that you recommend they do?
I would say one is, the first thing that comes to mind is do challenging things, right? Challenge yourself, push yourself, and that can be a great source of self-esteem, right? So it's like, okay, I can do hard things, whether that be a long bike ride or you decide to submit an article for publication or something, or you decide to take a leadership position in your PTA. By trying to do these hard things, you demonstrate to yourself that you can do hard things and you develop self-esteem from that. Also, too, is reaching out to those people who got your back, who've known you for years and years, your friends who know you. I mean, I talked with a friend, I hadn't talked with her since before the pandemic, and she's one of my friends from childhood. And she's one of those friends, like, you can talk with them and you just catch up, like, right from where you left off. Like, life happens. And then it's just like, it was like yesterday you talked with them, even though it's like, it's been a year.
Right.
And she was like, wow, that's something about you, Melanie. You always are doing something. You got something going on, something new. And I just admire that about you, and you get things done. And it just really touched me because she's known me since I was a little girl. And that also contributes to your self-esteem. When people are saying things about you that really know you, and they're saying positive things, that helps self-esteem too. Surrounding yourself with positive people. There's a Jim Rohn quote, where we're the product of the 5 people we spend the most time with, that environment, right? And I think it's so important. You have to choose your friend group and your peer group because they can build your self-esteem up and have you feeling good, or have you feeling, pretty bad if it's a lot of frenemy stuff and, right?
Right. Yeah.
Yeah. And then also too, positive self-talk, telling yourself,
Yeah.
atta girl, look at yourself in the mirror, I know it sounds a little hokey, but it works, taking that stance and, saying, hey, I look good today. Or I'm really proud of how I handled myself in that meeting. Or, I had a good discussion with the teacher at my son's school today, and I feel good about that. So giving yourself, some praise and accolades and talking positively to yourself, in the mirror, in the bathroom by yourself, you can say, hey, you got this, and that's important.
It is. That's a good one. Those positive affirmations, those are important.
Yes.
I think it's hard for a lot of women to do that though, and without being called narcissistic, of course.
No. It's being your own cheerleader, rooting for yourself.
Right.
And if you want to reframe that as saying, I got to do this so I can be the best mom I can be the best partner I can be the best niece I can be. I gotta build myself up. And again, if people who worry about being a narcissist, it's almost by definition they're not narcissists, because they can't introspect, they can't reflect, right? So it's almost like impossible for them to be a narcissist, because the narcissist thinks they're great. Like, what's the problem?
Right. So let me go back to some questions. Let me see. Elon Musk is considered a narcissist by people that know him.
He admitted that he has Asperger's. He's on the spectrum. And there are a lot of similarities, to be honest, because some people who are on the spectrum, they may not pick up on social cues very well. They may seem to lack empathy, although they do have empathy, but they may not be able to say it or demonstrate it in a way that the rest of us neurotypicals are used to. And some people can be very rigid and structured, like I have to wear the same shirt every day. I have to have this routine, a different way of thinking and looking at the world. But folks tend to be very, very bright, think about like Bill Gates, Steve Jobs, Elon Musk, but they have a difficult time just relay that casual conversation, being people. And so people might see them in that way, but it's really something else going on. I don't see it as narcissism.
And Ye76 says, my coloring book in watercolors, it's so relaxing and eases my mind. I love to color. I love adult
coloring books are great. Oh my gosh, I love those coloring books. Yeah, they are great.
I have one with Black women. Well, they're not Black until I turn them black, but they all have these really nice head wraps with all these different shapes and these big earrings, and I just go in on that coloring book.
Wow. I have a Psalms coloring book that I really like, because I'm reading the Psalms, which is very calming while I'm coloring. Yeah, it's a really nice for folks who are Christian. It's a really nice, comforting one. Yeah.
Curling Green, I'm going through a lot in my life at this time. I almost lost my partner to COVID. Oh no, I'm emotional every day. I cry a lot and don't know how to stop thinking. Help, please.
Oh, well, first of all, I'm so sorry that you went through this year. And, I'm really hoping that you'll consider getting some help. Going through one of those websites is a nice, secure, easy way just to see if there's therapists in your area. And you can also reach out to a friend or family member and say, look, I'm just feeling so overwhelmed. Can you go to these websites and see if you can maybe find someone for me to see and make the appointment for me? Because sometimes some people are feeling just so sad and, overwhelmed that they don't have the energy to even make the appointment, And so you can enlist your support team and ask a good friend or family member, I think I want to talk with someone about some things I've been going through. Can you help me make an appointment? Or can you, and the nice thing too is, in the past, I used to say, ask them if they will drive you to the appointment. But now, with so many people doing remote work, it's even easier, to make appointments with folks. And on those websites that I gave out, Psychology Today and also goodtherapy.org, you can see which ones offer telehealth. So that's an option too for folks who just aren't able to get out of the house. So, you're worth getting the help. You deserve getting the help, and get some support and feeling better. And that therapist may suggest that if it's indicated, you get an evaluation for possible medication. And not everyone needs medication. Sometimes just, seeing a therapist for a while, for a couple of months or so can make a big, big difference. But there's some people who just aren't able to function. They're not showering. They don't want to, they can't take care of their kids. They just feel overwhelmed by life. Maybe they're, even having what we call passive suicidal thoughts, where they feel like, maybe the world will be better off without me. Not that they actually want to do something, to end their lives, but they're just feeling hopeless and helpless. And so sometimes medication's indicated, and I've had to prescribe antidepressants for folks, during this time. And again, it doesn't have to be lifelong, but sometimes people need another intervention too, in addition to the therapy to help.
How do you recommend people, and I don't want to use the wrong term here, but I guess it's excusable for me. I'm not a therapist. How do you suggest people get out of their own head? You know what I mean by that? Like just thinking and worrying and about stuff that hasn't even happened or isn't even a thing.
So that's anxiety right there, right? And so talking can help, but also there's a type of therapy called cognitive behavioral therapy, and it's looking at how our thoughts influence our behaviors, right? So we might have the thought that, oh, because we failed this exam, I'm never going to, get into school. I'm never going to get a job. I'm worthless. I'm useless. And so then you start ruminating, I'm going to be homeless and no one's going to like me. And, just this catastrophic thinking. And so CBT helps to look at those thought distortions, because they really are thought distortions. It's not you really thinking this, it's your brain almost kind of like a mind of its own in a way, right? Where, it's coming up with all these negative thoughts and bad things that can happen that aren't likely to happen. Okay. So just because you failed an exam doesn't mean you're going to be homeless. Okay. So CBT, getting a CBT therapist can really help you to challenge these thought distortions. Now, sometimes some people are so stuck in the rumination that medication could be helpful. And when people are on the right medication, it can help decrease, that rumination. They're able to sleep better. They're not so hypervigilant, feeling on edge, like everything is a potential threat. They're able to feel a little bit calmer and able to get through life stuff a little bit better. So medications can make a big difference for some folks who really just, they're so overwhelmed by their thoughts, they're not able to function. Now, for people who just find themselves worrying from time to time, sometimes I'll just say, you can do a little something like journaling, of course, just writing things out on paper can kind of help get you out of your head a bit. And then doing something I call the worry chair. So you can tell yourself, okay, I'm not going to worry about this right now. I'm going to sit in my worry chair, which is going to be a designated chair that you have in some part of your house or your apartment. And you get to sit there, you set a timer, you can worry for 30 minutes. Just worry all you want to.
Worry about everything.
End of that, you wrap up, you're done with your worrying for the day. And then you can, wait until the next time you have an appointment in the worry chair. And this is for people who have just mild anxiety stuff. Like they're thinking, gosh, we're going to have World War III and this is going to happen. And, just kind of go there, not like the day-to-day stuff. But worry chair sometimes is a good idea. And when I was younger, I remember I had all of these worries when I was trying to get into medical school. And so I took a legal pad just like this. And I wrote each worry on a line and I cut them up, and then I put them all in a jar. And I said, I'm just putting these worries in this worry jar. I'm going to give it to God. I'm going to let this go. And I found that worry jar actually 2 years ago. Can you believe that? And all the stuff I thought I was going to get cervical cancer. I thought I was all this stuff, the craziness, I thought, oh gosh, if I don't get to medical school, I'm going to be a complete failure. And oh my gosh, this is going to happen. And none of those things happened. None of the things I was worried about actually happened. So
that's funny. I have a question about medication.
Okay.
Is it true that if someone is on medication, like if they're taking psych meds, there's never an end to that? Like if you start taking psych meds, you will pretty much be on psych meds for the rest of your life?
No, not necessarily. And so what I like, and there's no hard and fast rule to this, but like if I have a young patient who's come in, or middle-aged patient, doesn't matter, they've never been on antidepressants before, but I'm seeing enough going on that I think it might be helpful to have a trial of medication. I tell them to give it a year. Okay. And I tell them to not stop the medication unless they're talking with me about it, or some other professional, whether that be their primary care doc, or the nurse practitioner. But I tell them just give it a year, because what happens is they'll start feeling better on the medication, usually in 3 to 6 weeks. And then inevitably what happens is a couple months later, they're like, I don't want to take this medication anymore. I'm feeling great. When it's really the medication that's been very helpful for them. So what I say is give it some time. And then when you want to get off of it, let's make sure you're, in therapy, or you have connections with someone, so that if you do start to kind of slip a bit, then we can handle that, versus you just stop the medication on your own, and then your symptoms come back, and sometimes even worse. So continue to take the medication until a healthcare professional tells you otherwise. But a lot of people, sometimes they're just on the medications for a little bit and then they're off. And there's some chronic disorders like bipolar disorder or schizophrenia, where usually patients are on medication long-term, to be honest. But sometimes anxiety disorders, depressive disorders, they may just need to be on medication for a short period of time. Now, for some people, let's say if they've been hospitalized, or they've had suicide attempts, or they have a strong family history of mental illness, we would likely suggest that they stay on the medication for a longer period of time.
Okay, that's good to know, because that's always something that I've heard, that, someone starts taking that, especially with kids. You hear it a lot, like, when someone wants to put kids on medication, they're like, they're going to be on that stuff for the rest of their lives,
Yeah. I think especially with kids too, it's always good to like reassess, just because the kids have been on the medication for a while, it's important to reassess as they're growing and getting older. Because sometimes kids can have a break, let's say ADHD meds, having a break from the meds during summertime when they don't need to focus as much, and so there's all these different options and ways of doing things, but it doesn't necessarily mean they're going to be in the meds forever.
Okay, well, that's good to know. Okay. All right.
I want to say something, because I'm kind of just looking off to the side. I'm not really paying as much attention to the.
Go ahead. If you see any comments you want to,
yeah,
definitely.
Some people are talking about faith, and my faith is very important to me, and oftentimes we'd hear in church, well, just pray on it. God's going to heal you, and, he's going to make a way for you, and you're going to be fine. We're going to give it to God. And I tell people, God also wants you to do the footwork, and God also wants you to use the tools that he's provided for you, right? So if you had a broken leg, you can pray on your way to the ER. Prayer and medical treatment are not mutually exclusive, okay? You can combine both, okay?
You can pray and go to therapy, and you can pray and take medication. Yeah.
You can even see a Christian therapist if that's really important to you, going to one of the sites, and you can put in that you want to see a therapist of your same faith. So I think in our community, there's too much of that. Oh, I'm just going to give it to God. And, so you can give it to God and also see a professional at the same time. Okay.
All right. I'm glad you said that. Yeah.
I hear all the time.
So glad you said that. Someone mentions exercise, magnesium exercise, even just walking take your time. You can get out of bed, function. Yeah, diet has a lot to do with your mental as well as your physical health. I learned I was taking this class and I learned something that totally like shocked me. It was one of the most interesting things that I learned in the class. And I think I really paid attention to it because I have a really good friend who worry, stresses, and trying to lose weight and cannot lose weight. And so I learned that the brain cannot differentiate between like real life trauma and thought up junk, right? Thought up trauma. And so I think like the example that they gave may have been something like, say, for instance, you're running from somebody, you're running from a killer, right?
Yes.
And you're not really running, but in your mind, you're like, oh my God, he's chasing me. Your body still reacts and responds the exact same way that it would if you were really actually running from somebody who was trying to kill you. It shuts down your digestive system because you don't need to digest food when you're running, right?
Right.
And so I was like, oh my God, that is really something to know that, yeah, your brain does not know the difference between made up stuff and what's really going on in your life. So I had to share that with her. I was like, you need to think about this.
Yeah. So we call it the fight or flight response, right? So our bodies, like let's say there's my door right there, right? So I'm not expecting any patients right now. It's a Saturday night, okay? But if someone were to knock on that door right now, my body has to prepare for the perceived threat. So I'm either going to try to fight, the threat, right? Or I'm going to try to flee. Whatever that is, I'm going to need my blood pressure to go up. I'm going to need my heart rate to go up. I'm going to, get muscle tone.
Exactly.
I'm going to be ready to do the threat. But the challenge with anxiety is that you're vigilant, you're hyper vigilant, you're preparing for this threat that isn't really there like all the time,
all the time. Yeah.
All the time, just, kind of thing. So through therapy and sometimes medication when appropriate, it can be so helpful to look at those thoughts, to really explore, okay, what's the evidence for this? I am safe, working on meditation, progressive relaxation, guided imagery, hypnosis, deep breathing, all those things can really help. And challenging those thoughts and working on reducing some of that rumination can be really helpful.
Yeah. And someone said, Rose says, I eat when I'm nervous. And Rose, when you're nervous eating, your body is not doing a good job of digesting your food.
Right. That's right. Because your body is not, like you were saying, your body is not focused on digesting food. It's when you're anxious.
Yeah.
So, but that is something, worth talking about is emotional eating and also substance use. So there's a lot of people out there who are struggling with anxiety and depression. You just wouldn't know it. And they're coping about it in ways that, are unhealthy, but they're not fully aware of that. So people who might be drinking because they can't face the feelings that they're feeling, right? Dealing with life on life's terms, as they call it in recovery. People might turn to food. I'm so mad at my boss and I'm going to just comfort myself with this mac and cheese or this whatever, this red velvet cake. But then you do yourself a disservice, right? Because not only are you doing something that's not going to be helpful for the actual problem, but then you're feeling guilty and bad about, eating the food over it,
Right. Yeah.
So what's more important is to perhaps see someone and talk about, okay, maybe this may not be the best job for you, or how can you assert yourself with your supervisor and tell them I'm not able to be the most effective employee when you give me all these tasks and expect me to have them done, by the end of the day. So setting those boundaries and talking about how you can be a more effective worker versus, this boss is impossible. There's nothing I can do about it. I can never get another job. I'm just stuck. I'm just going to eat, to make myself feel better. But then it's not a healthy way of dealing with the problem. And so same thing with substances, people turning to, marijuana or alcohol, meth, cocaine, whatever, because they can't feel the feelings. And so when we want to turn to those substances, we need to ask ourselves, what is it I'm avoiding? What is it I'm not wanting to look at this moment? What's so uncomfortable that I feel like I can't deal with this head on?
Yeah. So diet is massive. You must eat as healthy as you can. Absolutely. Lettuce and carrots if you can. Just that's
lettuce and carrots
in our lives.
Not the mac and cheese and red
regimen.
I will say too, just talking about substance use and stuff, I just want folks to know that in some ways, COVID has given us a big gift in terms of more resources available online. And so there's Alcoholics Anonymous, there's Al-Anon, there's Codependents Anonymous, there's Overeaters Anonymous, there's all of these free online available resources, and you can show up anonymously. You know, if you just want to join an online meeting but not have the video on, you can do that.
Oh yeah. Oh wow.
And so all over the country, it used to be people were limited by the meetings that were in their geographic area, but now you can attend meetings all over. And it's been great, you know, for a lot of my patients who were like, oh, I don't want to go to a meeting over here because I might bump into somebody I know, or, oh, those people won't be like me, I won't fit in. Well, you can try multiple meetings, basically almost 24/7 anywhere. So.
Oh, well, that's good information. Yeah. So what we'll do is actually, I will link, do you want to send me like just a little list of the numbers, like the crisis number and your information, and I'll add those to the video once we're off. So
sure.
Yeah. Okay, so do you guys have any more questions for us? Anybody? Do you have anything you want to add? This is fun.
It's really fun. So I'm just gonna throw a little plug for myself here because
absolutely.
Yeah, so I have a book. It's about 10 years old now. I might actually do an updated version of it, but I wrote a memoir using my journals from when I was, you know, younger. I was a single mom and a teen mom, and I went through med school with my son. And this is my book. It's on Amazon. It's called Taking My Medicine. And I think a lot of you will find it inspiring because I went through a lot when I was younger. And I think a lot of you will resonate with what it was like being a young African-American mom. You know, I was pregnant at 16 and had my baby at 17. And I always wanted to become a doctor. And you can imagine a lot of people were like, that's not going to happen. My mom was like, you can be a nursing assistant. And I was like,
wow, really?
There's nothing wrong with being a nursing assistant, but that was
nothing at all.
No, but that was the highest thing that my mom could see for me because she saw me as, you know, a teen mom. And I said, Mom, I really just want to try to see if I can become a doctor. I really want to try that. And so, you know, I had a lot of professors and teachers who stepped in, and my faith was very important to me. And so I was able to go to Stanford Medical School, and I went to UCSF for my internship and residency, all that stuff. And so I just want people to know that even if you have challenges, obstacles, that's part of, you know, making you stronger, and you can reach out and get support from other people. There are people who genuinely do want to help you. You just have to be able to, you know, say what you need and say, hey, this is something I want to accomplish in my life. How do I go about doing this? And you'll find people that will believe in you. So yeah, it's on Amazon.
Amazing. I didn't know that. That's amazing. That just goes to show you can do whatever you want to do. You know, and to the young single mothers out there, although we don't encourage you become a young single mother.
Right. That's right.
Yeah, life is not over for you. You can still be, you know, you can do what you want to do. That's amazing. I love that.
Thanks. Yeah, my son now is 27. I'm 44 with a 27-year-old. And he's in grad school studying English. And yeah, it's been quite the journey. I've been very, very fortunate. But then I also did the footwork, right? So I want to tell people, like, of course, God gave me, you know, wonderful gifts, but then I also had to put myself out there. And there's a lot of lessons I learned, a lot of challenges along the way. But yeah, it's quite the page turner. if y'all want to check it out.
Definitely, I'm gonna get it tonight.
Oh, okay, good.
So we'll link that in the description box as well. The information to her book. And Dr. Mel has a YouTube channel. So how often are you gonna do videos on your YouTube channel?
I'm still trying to figure that out. I'm really excited. I've been so impressed by what you've been doing. And I like the idea of talking about mental health topics. So I might start off just doing something like, once a week or so, and then just see if it's up from there.
Once a week is usually how often people look for you. Anything less than that, they'll be looking for, like, where's that? Yeah, that's good.
I love how YouTube is bringing people together and the sense of community. I was just seeing the chats going through, and then we connected. It just it's really amazing how this community is formed.
Yeah, it is. It's pretty amazing. I mean, think, like, what was it? Well, for me, has it been 10 years? Have I been on YouTube for 10 years? I mean, not like on YouTube, but watching YouTube for 10 years. Yeah, let's go back about 15 years before there was YouTube. The only way you had to meet people was like Yahoo Messenger.
Oh, wow, that's going way back. Wow.
Right. And actually, that's more than 15 years ago. That's probably like, what, 20 years ago.
Yeah, wow. Maybe go back to AOL and dial up and all that.
In MySpace. And
dating ourselves. I know, MySpace. Right. I remember 2007 when one of the residents of my program, she's like, you should check this thing out. It's called Facebook. It looks really, really fun.
Yeah. I remember the first time I got on Facebook. Hilarious. Okay, so thank you everyone so much for joining us here tonight. And if you have a question that we missed, then after the video, when the video is actually gone public and everyone can see it, if you leave it in the comment section of the video, then we'll make sure that we get your questions answered. So thank you so much.
Thank you. This is wonderful. Yeah, I really enjoyed it.
We'll have to do this again.
Yeah, that'd be great.
All right. So good night, everyone. You guys have an amazing weekend, amazing holiday weekend. It's a long weekend, right? This weekend. Monique, you're so welcome. Good night, Mighty Strong. Sonia. Dania Watkins. All right. Good night, everyone. Thank you guys so much.
Bye-bye.
Bye. Now I have to figure out how to end my live. There we go.